Hi, and welcome to another episode of the Soapbox. This month we're focusing on knee injuries. And so what we're going to do today is I'm going to show you the first out of 3 video series where I show you my favorite tape jobs for the knee. The first one we're going to look at is for what's called patellofemoral syndrome. It sounds way more intense than it actually is. So patellofemoral syndrome is basically a fancy way of saying a patient has a knee tracking issue. So if we look at the knee here, we have the kneecap that sits in a little groove over top the thigh bone and the tibia, okay, to make up the knee joint. What happens most of the time when you have patellofemoral syndrome is it's usually because of a weakness at the hip and it can't control where that thigh bone is in space. So you get kind of the knees collapsing in when you go to bend, like say in a squat. So usually the issue with the knee tracking has to do with weakness of the hip, and also with the knee falling in, you will start to get tightness in along the lateral side or the outside of the leg. Hip included, thigh bone or the IT band, and also down on the side of the shin. So if all these tissues are tight on the outside, what it does is it actually starts to pull the kneecap off kilter. And now we're bending and straightening our knee with a little bit of poor tracking of that kneecap, and that can cause irritation of the cartilage that's underneath the kneecap. And so patients will describe like there's like achiness in and around the kneecap. They might have pain more on the inside of the knee. And so that could be what's going on. Again, if you've had pain in the knee for more than 2 weeks, I'd say definitely get it checked out by a health professional. But if you're starting to have some pain in the knee, keep an eye on your tracking, right? Knee over second toe when you're doing any squats or bending. And also you can start to do some release work. We'll show you in an upcoming episode. But you can also try this knee taping. And again, just remember, none of these tapings should be done in isolation, should always be done in conjunction with a strengthening program or something prescribed by a health professional. Okay, so the first thing we're gonna do is we would just like clean the area. So if we've been working or massaging and there's some oils, just make sure the area is clean. Again, I'm using my dynamic tape. Doesn't matter what brand. I like K-tape, but again, it's totally up to you. You can get this at the drugstore. And if it comes pre-cut, we do like to kind of tape it custom for this one. So you'll notice I've cut 2 Y strips and I just round the edges just so that it doesn't peel as easily. So if we start on this knee here, her left knee, we're gonna start the base of the Y strip on the inside of her thigh. So I'm gonna rip the edge of the Y and I'm just gonna lay that down along the inside. I'm gonna prep my tape, hold the base, I'm gonna do a little pull and she's gonna bend her knee just to about 90 degrees as I pull that across. And then she's gonna straighten. I'm gonna prep this tape again, hold, little pull, and bend. They don't have to match up, but it does need to be long enough to actually pass the kneecap. Give that a rub. And now with my second strip, I'm gonna do kind of a mirrored version of this, starting again on the inside of the shin. So I'm gonna rip the base of the Y, start it on the inside, prep the end, hold, little pull, she's gonna bend as I bring it across, and then straighten again. Again, I hold the base, little pull, and she's gonna bend. And as you can see, we've kind of like gone around that kneecap, and that's all it is. And she would leave that on about 3 to 4 days.